4.55 billion. Care to guess what this number represents or stands for? That is the total number of active users on social media globally as of January 2022. What a mind-boggling number. But most of us will not be surprised by this number. The fact of the matter is our lives are ingrained in and around social media, right from the time we wake up in the morning to the time we go to bed every single day. Be it something trending on TikTok or an important news headline, information and communication technology has changed the way we've lived over the past 20 years, with a key development being the emergence of social media. That is king now. The pace of change is accelerating every day. For example, the development of mobile technology has played an essential role in shaping the impact of social media. Across the globe, mobile devices dominate in terms of total minutes spent online. They put the means to connect anywhere, at any time, on any device in every person's hands. But we've also heard, right, social media has always been applauded and at the same time criticized for various reasons. But the harsh reality is that we cannot communicate with each other effectively without social media today. The most recent and most biggest example, I think, would be COVID. During the pandemic, social media platforms played such a vital role than all the other normal days. It was social media platforms that were used as a tool for professional communication in healthcare, which helped save so many lives. And during the pandemic, social media use has accelerated to the point of becoming in every single place now all over the world. It's become part of modern healthcare systems. There were many cases like those people who utilized the power to connect to the right people for help through social media platforms. And we are here to bring you one such amazing real-life story which harnessed the power of social media to bring good to society. It is an amazing story. Just watch this.
Jhelum flows smoothly through lush green mountains in Uri sector bordering Pakistan. But people living in these hills are often facing tough times. Living over 100 kilometers from main city of Srinagar. When Sheikh Nuruddin, a Jammu and Kashmir policeman, suffered a heart attack in November, he had no hope of survival. In absence of a cardiologist in the remote area, a WhatsApp group, Save Heart Initiative, launched by cardiologists in Kashmir, came to his rescue. As the 59-year-old cop was taken to primary health center in Boniar, doctors used the online platform, received real-time guidance from cardiologists to handle the cardiac emergency.
मर भी सकते थे सर, क्योंकि जब ट्रीटमेंट टाइम पर नहीं मिला था तो फिर बंदा मर भी सकता है. उससे पहले वहाँ की हमारे गांव में बहुत वाक़े हुए ऐसे, तो अल्लाह की मेहरबानी थी. तो डॉक्टर साहब ने मदद की, फ़ोन पे बात की उन्होंने उनसे, सर उन्हें इसको कौन सा डायग्नोज करना है. तो वहाँ से उन्होंने उनको बताया कि ऐसे ऐसे करो, तो उन्होंने मेरे को वही डायग्नोज करके तो इन टाइम मुझे सूरा में पहुँचा दिया.
Social media apps like WhatsApp helps people even in the remotest of locations to stay connected with each other, and that is what helped Nuruddin in his hour of need. For last 7 years, over 1 lakh ECGs have been processed by the Save Heart online platform, having 1,200 doctors on board. Dr. Parvez Masoodi, Block Medical Officer Boniar, and his colleague Dr. Javed Vani say they had never thought that smartphones will come so handy for critical healthcare in border areas. This is how they use smartphones for critical care in the health center. As soon as a cardiac emergency reaches first medical contact, the doctor uploads patient's ECG on Save Heart WhatsApp group. Immediately, a cardiologist on the group evaluates ECG, guides doctor how to handle patient in the first golden hour. Moments like this, when time is of essence, having sharp photographs of the ECG or having a good quality video call is of utmost importance. This helps the doctors provide the right treatment plan to the patients in a timely manner.
Immediately we upload within 10 minutes to Save Heart Initiative group, where from the doctors who are there, the cardiologists guide us via text message or video call, or they call directly to us and they guide us how to treat the patient, set patient, and what to do. At every step we do follow them.
वो पेशेंट जिनको थोड़ा सा कंफ्यूजन होता था ईसीजी में, वो 2 किलोमीटर इन रिमोट एरिया से स्किम्स आना पड़ता था उनको, श्रीनगर आना पड़ता था. इस सेव हार्ट ग्रुप से या इन फ़ोन गैजेट से या इससे स्मार्टफोन से क्या हुआ, ECG विद इन 10 मिनट्स, विद इन 5 मिनट्स अपलोड हो जाते हैं एंड कंसर्न कार्डियोलॉजिस्ट सजेशन देता अपनी कि इसको क्या करना है, इसको क्या करना है। मैंने ज़िंदगी में कभी नहीं सोचा था कि फ़ोन डॉक्टर से ज़्यादा बढ़ के काम करेगा, बिलीव मी।
After heart attack, Sheikh Nuruddin has now 3 stents implanted. His family say they couldn't believe that first treatment of thrombolysis was possible at their doorstep, which saved his life.
नहीं वो नहीं पता था इधर मिलेगा इसे डॉक्टर को, कसम से इधर जाकर मिला है इसको डॉक्टर, अच्छी तरह दवाई शवाई दी, आगे पहुंचा उधर, शुक्र अल्लाह का, उधर भी यहाँ बच गया, शुक्र।
1200 doctors are a part of Save Heart initiative. They are using smartphones and online platforms, saving hundreds of lives in Kashmir. For last 2 years in this primary health center in Bonyar, which is near the line of control, de facto border between India and Pakistan, more than 30 lives have been saved in this primary health center by using smartphones and Save Heart initiative.
Save Heart initiative was started in 2015. After Dr. Nasir Shams, posted at Amarnath Yatra in 2015, received a cardiac emergency, a WhatsApp call to his cardiologist friend who helped him to save an Amarnath Yatri, firmed up the idea to have an online platform of doctors to handle cardiac emergencies through the use of smartphones.
We sat over a cup of coffee and we discussed that why cannot this be broadened and provided as a life-saving option to our people using the same network which I used that day. The phone which I had, the communication link which I had at the tertiary care, and the interaction between the group of doctors which helped me save a life there. This coordination, not working in our own aisles, helped us. This created a unified network among doctors, and this was the concept.
It's the best use of smartphones that's making a huge difference in cardiac emergencies. A quick redressal through online platform Save Heart initiative. As they say, time lost is a heart lost, and use of smartphones is proving a boon for the people in need of critical care. In Srinagar with cameraman Amir, Nazir Masoodi, for NDTV.
What an incredible story, right? I mean, this is called game changing. This is called saving lives, and it's all happening because of our mobile phones, social media, and technology. Let's now go and talk to Dr. Nasir Shams. Doctor, where did the idea of utilizing social media platforms such as WhatsApp come into this scenario?
You see, it was July 2014 and I was working in the most difficult terrain of Himalayas, that is the Baltam. That is 9,000 feet above sea level, and I got a STEMI patient right there struggling for his life. And first hour was critical for his life, and we worked him up, we treated him, and I utilized the same social media platform to arrange further care for him at the tertiary care of Sher Kashmir Institute of Medical Sciences. And it worked. And subsequently, we treated many patients like this, and this idea came into being.
Doctor, that's great. Very fascinating that you thought about it like this. But you know, the big question that comes up is, are you really able to help and treat patients through video calls? I mean, many people say that's not really the same as meeting a doctor.
Video calls is via WhatsApp only, and once our peripheral most doctor wants a further expertise from us, we act as experts, we act as their guides, and he wants further instructions, and we feel that he needs further instructions live, and we opt for video calls and advise him then and there. This video call shortens the time and provides the fastest possible treatment right there, even if it is at the toughest border of the LOC.
Wow, how fascinating. Okay, doctor, how many lives were touched upon via this medium?
You see, we never expected. We 3 friends started it in 2015 onwards, and then Directorate supported us fully with all the medications and upgrading ERs. As of now, lately, more than 50,000 lives have been handled, and more than 120,000 ECGs have been analyzed and discussed with each other via this forum.
Wow, that is such an incredible thing that's happened. Okay, what is the importance of having a smartphone which can do great live or recorded video or audio, especially in geographical locations where the terrain is very difficult? You know, doctors can't go there, the patients can't come out from there. Is this a life changer, a game changer?
The idea and the utility of the smartphone is the Save Heart Kashmir will prove by itself. The data, the work of our 1200 doctors who are connected to each other, and they are providing you a facility of a virtual hospital, one of the world's biggest virtual hospital via WhatsApp, and which is day in and day out saving lives.
Thank you so much, doctor. Thank you so much for speaking with us. Snapdragon is calling all Cell Guru fans to join their global community. It's called Snapdragon Insiders, and it's amazing. This gives you access to the latest scoop on Snapdragon tech, a chance to connect with the biggest experts behind the scenes, premium experiences, exclusive contests, and much, much more. Now, I am a Snapdragon Insider, and you can become one too. Simply follow the Twitter account or Instagram that we're giving you on the screen here right now. Also, give yourself a chance to win a Snapdragon smartphone by participating in the NDTV Snapdragon contest. All you have to do is go to ndtv.com/unleash your dreams. I'm showing you the URL right here.